What if you could give your look a lift on your lunch hour? What if you could reduce wrinkles without any surgery and without pain? No needles, no anesthesia, no downtime. Well, we found a new, fast, and surgery-free way to have younger-looking skin. Here with us this morning is Dr. Flor Mayoral, a board-certified dermatologist from Miami, an expert in skin rejuvenation treatments. Good morning, doctor.
Good morning. How are you?
Great. Thank you so much for being here.
Thank you for having me.
When I think of skin rejuvenation, I kind of think of, the Botox, the fillers, the needles, everything that I just say no to. But this is different and virtually painless.
If you hate needles, this is the treatment for you. It is a radio wave device that we apply to the skin and we move it in a circular motion. It warms the tissues, and the body will eventually replace that collagen that we have warmed up with brand new collagen.
Now you have some before and after pictures of some patients that have
yes.
really been very happy. If you could talk to me about what we're seeing.
Absolutely. These patients have, for example, before and after pictures, it's very obvious that the eyes look brighter, the skin looks smoother, they look less tired, and they look younger than they did before we did the procedure.
And there's no burning, there's no anesthesia?
Nothing. All you do is you show up, 15 minutes later you leave, and you look much better, and your skin looks smoother and tighter.
Something I've noticed when people do some other treatments, like Botox, for example, they just don't look natural to me. This would be different.
Well, people would just say, I love the new hair color you have, or you look so rested, you look fabulous, I hate you, kind of, those are the comments you'll hear. And it's because you look better than you did, they just cannot figure out why you look so good.
It's not one of these in your face, if you will.
Absolutely not.
It's
no.
very just
exactly
natural, you're glowing, and people are just looking at you going,
and you look great.
Huh. Now, what about the eyes? I'm very worried always about doing anything around my eyes. It's very sensitive. How could Pelleve help me?
Actually, it's the ideal thing to do around the
Really?
eyes. If you are worried about looking tired and you have a party or something important that you want to do, you come in, we do it around your eyes, and then you go off to your affair, and you look fabulous, and you look better than you ever did, and you have no telltale signs that you did anything at all whatsoever. Radio waves have been approved by the FDA for removal or improvement of wrinkles.
And I'm building my collagen at the same time.
Absolutely. You will start building your collagen, and your body, after we warm the collagen, your body will replace it with brand new collagen.
Well, we actually went to your office, as you know,
yes.
and we want to tell our viewers, we spoke to two patients who are thrilled with this new treatment. And Vivian Calvo, she actually did some treatment around her eyes, correct?
Exactly, yes.
And she has a wonderful testimony here, so let's take a look, okay?
Of course.
Hi, my name is Vivian. I'm 67 years old, and today I'm having my third Pelleve treatment around the eye area. I have an event coming up. I just need like a quicker picker-upper so I look fresher. It's not painful. Sometimes it gets a little bit uncomfortable, but it's not painful at all. I believe my skin looks firmer. I believe the dark circles are gone, and the eyelid on top, the upper eyelid, doesn't look as tired. It doesn't look as droopy.
Great results. She's happy. How long did that take?
15 minutes.
15 minutes. All right, stick around. I have more questions for you, okay? And when we come back, we're going to tell you how long these results will last. That's what I want to know. And we're going to see the before and after from a lady who has the full facial procedure. So don't go away. So she did that. Welcome back, everyone. This morning, we've been talking to Dr. Flor Mayoral, a board-certified dermatologist from Miami, about a revolutionary new procedure for reducing wrinkles without surgery or downtime. You can have this done on your lunch break. That's how easy it is. All right, doctor, so welcome back again.
Thank you.
We've talked about how wonderful this new procedure is, how non-invasive it is, and how women are loving it. But my question to you is, how long do the results last?
They have shown that 87% of people that have a single treatment still look good 6 months after having one procedure.
So you can actually come every 6 months or every year? Is this on,
Some people can choose to do, for example, 2 or 3 procedures, spaced 2 to 3 weeks apart. When you think you look great, you stop doing it, and maybe every 6 months or so you do a maintenance treatment so that you can use this as part of looking younger.
A little tune-up, if you will.
Yes, everything takes tune-up.
There you go. Now, Can something like this replace, you know, the Botox and?
They're different. I mean, Botox will relax your muscles. It's something, remember, you have to inject it. It will relax your muscles. You can do Botox in combination with this, but the truth is you don't have to have Botox. You can do this by itself, and you will always look better because this makes your body replace the collagen with brand new collagen.
Now, we had talked earlier before we came back from our break about a full facial procedure.
Yes.
I'm thinking that, and I'm thinking that's going to take hours. How long does that take?
No, 45 minutes to an hour, depending on the person. Remember, if you have a bigger face, it takes a little bit longer. If you have somebody with a small face like you, 40 minutes, plenty of time to do it.
Are you like coaxing me into this?
No, we would never do Beth, remember. We have to do you.
Beth doesn't need it. It's me. I'm the older one here. Now, earlier we talked about another patient, Caroline Garcia.
Yes.
She did the full facial procedure. So let's see her results and how happy she is, okay?
Okay.
Let's take a look.
Hi, my name is Carolyn. I'm 35 years old, and I'm here for full face Pelleve, and I'm very excited. It gets very warm and pretty hot, but it's actually very relaxing. It feels like a massage. It's not painful in any way. It's great. I'm really thrilled with the look of the face. It's a lot tighter, and I feel like it's taken a few years off. I'm gonna tell my mom, my friends. I'm thrilled with the results. I would recommend it to anybody. I would do it again in a heartbeat.
Wow. I love it.
I know.
She looks great.
Yes.
Now, what can Caroline expect when she walks out of your office?
Every once in a while, somebody will have a little bit of redness, a little puffiness. It can last 2 hours. Maybe by the next day, they will look great. But truly, most people walk out of the office looking their best.
And they really notice something when they get in the car? Because I would be like looking in the rearview mirror right there.
Absolutely. We actually show patients the minute we do one half of the face or one eye, the difference between the side that we have treated and the side that we have not treated. I have never seen a patient be unhappy with that.
You were actually telling me in the break that girls just get together when the bridal shower is coming up, the wedding.
For a wedding, your daughter's wedding, for your own wedding, the bridal party will come in and they will all have Pelleve the day before, and they look fabulous the day of the wedding.
So, doctor, let's talk about who's a good candidate for this.
Anyone between the ages of 30 and 80 can do this procedure.
Okay.
But if you're a good candidate, if you think you want to have it done, you really need to ask your doctor if it's right for you.
So I have an idea. You're now my dermatologist, and I am going to ask you, may I do this?
Absolutely.
I think I'm going for it. Okay, I'm loving this. I'm game. I'll do a before and after of me.
We'll do it.
Okay, thank you, doctor, so much. And for more information on this treatment, just go to Pelleve.com, or to find a doctor near you, you can find Pelleve on Facebook.
This is called Pelleve. It's in
Pelleve.
Pelleve.
So el Pelleve.
Pelleve, right?
This is Pelleve.
Pelleve
Correct.
with an accent mark, right?
That's correct.
When you hear the words radio frequency, you probably think of a stereo, a TV, or even walkie-talkies.
But what if I told you it was the latest treatment in skin tightening?
If you could reduce wrinkles without any surgery and without pain, no needles, no anesthesia, no downtime.
Dr. Lawrence, exactly what is Pelleve?
Pelleve is a device that emits radio waves or radio frequency to stimulate collagen growth.
And then the energy is applied to the skin, and then if it gets into the dermis, it'll tighten the skin a little bit and promote new collagen growth. So that's the kind of essential thing.
That is what we want. We want that collagen to make it look a little bit less wrinkled.
So, Aidan, were you feeling it very hot?
No, not at all. It's just a warm sensation.
A warm sensation on your skin. Oh,
It's more like a warm massage.
Oh, okay. So a nice facial, getting a nice facial.
Exactly.
Right.
Treatment is a non-invasive treatment. There are no local anesthetics required. There's no needles, there's no cutting, there's no scar tissue. The trend nowadays is to go away from the surgical procedure. I think this is something which is going to take the cosmetic world by storm.
What should someone expect after the Pelleve procedure?
Immediately after the procedure, they should expect to see their skin, firmer and tighter, because we actually treat to a clinical endpoint, meaning I'm not going to stop heating and contracting that skin until I see lifting, firming, and smoothing. We set the patient up at the halfway point, they look in the mirror, and typically they just say, wow.
You can see the crow's feet area right at the corner of the eyes, has some improvement in the fine lines and some tightening in that area. And this is with no surgery, no pain, no needles, no injections.
Well, I'm a big believer in radio frequency, and this is just another way to do that type of treatment.
It's pain-free, and sometimes you hear that, and then you have the treatment done.
Right,
it's
you're
like,
yeah,
this
they were
is
lying.
not, yeah.
This
So
honestly
this is pain-free.
Okay, I'm halfway done.
You're halfway done.
One side. Can you tell the difference?
Botox will relax your muscles. It's something, remember, you have to inject it. It will relax your muscles. You can do Botox in combination with this, but the truth is you don't have to have Botox. You can do this by itself, and you will always look better because this makes your body replace the collagen with brand new collagen.
We both have used different forms of radio frequency in the past. I think the biggest thing that I see immediately is that this handpiece is so different than what we've used in the past.
This handpiece allows us to deliver great precision. We can focus on areas that the patient is really concerned about, which is wonderful.
Somebody said, you know, Jane looks a little bit different. Her face looks a little, you know, fresher or something. So I think it actually kind of works.
Does it feel good?
It feels good. It does feel good.